Hello, everyone, and welcome to this week's episode of Dose. Today, I'm joined by the wonderful Sara Siegel from Deloitte. She is the new global health sector lead at Deloitte. Sara, thank you so much for joining me today. How are you?
I'm very well. It's my pleasure. I'm thrilled to be here. Thanks, Blessing.
First of all, I have to congratulate you on your new role. Now, when I hear global health sector lead, it makes me think Oracle for all things health at Deloitte. But what does this new role mean? What do you do?
Well, there are health sector leaders in all of the countries in which Deloitte operates. So, at the global level, your job is really one of coordination and making sure that all of the different countries are sharing with each other. And where it makes sense, going to market with expertise from other countries or going to market with similar propositions. So, what we don't want is Spain and Brazil and China each to develop a proposition about virtual wards by themselves. When all of their healthcare clients are asking the same questions, we want to collaborate and think about that together. And yes, there will be customization required in each market, but it is always better to put our heads together and to do, the 80% core together and then to tweak around the edges, when we get in situ. So it is a lot about coordination. It's a lot about bringing expertise and examples that might exist in one place to other places where they could be relevant.
Mm.
And increasingly, it's about making sure that we have global relationships with the big alliance partners who we work with. Since a lot of the work we do is helping our healthcare clients to implement new digital technology, we're working with the same companies the world over. So we're working with the big electronic medical record companies, we're working with the AWSs, the Googles of this world, and they're operating on a global footprint. And even though each of our healthcare practices is national for good reason, because it's a very domestic industry, we need to maintain those relationships on a global basis. So it's those kinds of things I'll be focused on. And the other thing that I really want to do is begin a bit of a push strategy on all things net zero and sustainability. It's a topic which is obviously incredibly pertinent in our world in general right now.
Mm.
But what I see when I talk to healthcare clients around the world is they know it's important, they want it to be important, but they have so many other burning platforms that
Yeah.
it's not front of mind right now. So one of the things that I want to do is come to our healthcare clients and say, here are 5 things that you can do, which make financial sense and are also helpful from an environmental perspective, and begin to kind of help them on that journey. Because it's a question that they're not proactively asking, but I know they want to do work on it.
Yeah. Yeah, that's interesting. The net zero sustainability. This is something that's very much top of mind for a lot of private corporations, and it does seem that the health sector quite often is a little bit late to join in with a lot of new innovations. But how do you think sort of healthcare leaders or hospitals, how do you think you are able to get them to start this conversation? I know it started in a lot of organizations, but how do you actually get them to make it top of mind?
Well, in some countries, like in the UK, central government has made commitments to be net zero, by whatever year in the future. So those countries will push ahead. And in those countries and in other countries where there's not a central imperative, I think it's about thinking about the multiple layers of benefits that come from focusing on net zero. So for the most part, when you think about, I don't know, getting rid of, single use, materials in the hospital and going to reusable materials, it's usually a financial benefit as well as an environmental benefit. When you think about transport and travel costs, there's an efficiency gain, a financial gain, and an environmental gain.
Yeah.
And people are happier. There's a quality improvement. Patients are happier, and clinicians are happier. So I think it's about explaining the multiple layers of benefits. So unfortunately, people in many cases won't do something simply for the environmental benefit yet, but these types of initiatives line up on many levels.
Thank you for that. Now, you've worked within the health sector and NHS clients and different clients across Europe for over the last 20 years. And in that time, I know you would have come across many things. At the moment, we know that the NHS, I'm going to go into the NHS and staff shortages. At the moment, we know that there have been staff shortages for quite some time. But what do you think actually needs to be prioritized in order to address these staff shortages, or some of the things that need to be prioritized in order to address this?
It's such a big question. I think the fact of the matter is, and we see a lot of people who apply to our business who are leaving the NHS for a variety of reasons. But the sad truth is that in many cases, it is not the most pleasant or easy place to work. And so I think, there are many, many things that need to be done to address the NHS workforce challenge. But the most important short-term thing that I think NHS organizations need to work on is the experience. Why are rotas set so far in advance? Why is it so hard to change, when you're going to be going on holiday? There's not a lot of flexibility in the system. And a lot of those HR processes aren't very easy to use or access. There's a lot more manual processes in the NHS than you would see if you, say, worked in a bank. So it's a lot less user-friendly. So, if step one would be retain the current workforce, I think improving that workforce experience is incredibly important. And then the benefit that flows on from that is when people who are working in the NHS enjoy working in the NHS, people who might think about joining the NHS will be more likely to do so. And you won't have the situation we have now where we have fewer people interested in pursuing a career in the NHS because of the stories they hear. So that helps with step two. And step three, which needs to happen in parallel, is, as I alluded to already, there needs to be a lot more digitization of processes that don't require a human. Because even if we address steps 1 and 2, we're not going to create enough doctors, nurses, pharmacists, porters, et cetera, for the demand that our healthcare systems are seeing. So we need to make things more digitized. We need to put more responsibility on citizens and patients to do activities that can be self-service. We need to make sure that we're using the actual clinical skills that people have trained in. If you ask any doctor or nurse in the NHS, they'll say that they spend 30 to 40% of their day on what they would call admin. And it might be clinical admin, but it's admin, and it's not what they signed up for. It's not patient-facing activity. And in many cases, it's things that could be done by someone else or to a certain degree automated. So those are the kinds of things that really need to be accelerated to make healthcare sustainable for its workforce.
Thank you. So would you say then that there are potentially new roles that maybe don't exist right now, but could exist within the healthcare setting that might alleviate the current role of, nurses and doctors? Do you think perhaps in the future we're going to see a bunch of new roles that don't exist at the moment within the NHS?
I'm sure that's the case. I'm sure, as with anything, we could never anticipate what the future looks like. We've all been playing with, chat.gpt in the last few weeks. And, my brain just spins out with the different things that, with proper risk protocols and testing, a function like that could do. I don't think that healthcare is the first use case for that, by the way, but, in time. So yes, I'm sure there's lots of different roles that will spring up. There's lots of different functions. I think the whole process of accessing healthcare will change dramatically. And I think it's exciting and hard to predict. And I hope it will happen, much faster than the pace of innovation that we've seen to date on some of these areas of healthcare. We've seen amazing speed of innovation when it comes to things like, vaccine research and the use of mRNA, which will now, I'm sure, be used in cancer and lots of other diseases at incredible speed. But when it comes to things like the basic process of, accessing a professional, getting a diagnosis, accessing treatment, we really haven't innovated our processes there very well.
Mm-hmm. That is true. Thank you. I know this is meant to be a very short interview, so I'm going to jump into my next question, which is, out of curiosity, if you were made health minister tomorrow and you wanted to focus on just three things, what would those 3 things be?
Well, first of all, let me just say that I would not want that job. And hands up to Steve Barclay and everyone who went before him. I think that's a very, very difficult role. Absolutely. But if I found myself sitting in that chair, what would I focus on? I think 1, I would focus on making the NHS the pride of the country, the way that it used to be and the way that everybody wants it to be. Two, I would focus on future-proofing the NHS so that it's fit for future. We've talked for the entire 20 years that I've lived in England about how the NHS was founded on kind of a fixing broken pieces model. And we're now in a long-term conditions, multiple access points, multiple comorbidities model. But we haven't seen the structural change to deal with how we've changed as humans and how our healthcare needs have changed. And I think that that is a fundamental change to the way that services are structured, funded, paid for, and also the role of the citizen. So that's the second thing I would do. And three, I would make it the digital envy of the world. You see what happened in the US when the AMA was put in place, and it just was a catalyst to digitize healthcare. And I don't think that, we couldn't do the same thing in the UK. It doesn't have to be an incremental process. So if I found myself in that unenviable position, I would focus on those three things.
I think you'd make a great minister. Now, one of the things that you do is that you're one of the executives in residence at the UCL Global Business School for Health. This is a new school, the world's first business school for health. What is happening with this school is that they're essentially breeding a new era of leaders who are going to be focused on not just health, but also business. Why do you think that will be important as an executive in residence? Why do you think that will be important for the healthcare sector moving forward?
Sure. And this will be my last question because unfortunately I have to run. But I think that the blending of people who understand healthcare as a sector, as an industry, and people who understand business is incredibly important. So many times, we've engaged with clinicians on the ground in practice, and they don't always understand the commercial or financial or operational implications of some of the decisions that they make. And when these things are shown to them, they're like, oh, well, that makes a lot of sense. Then I would change it like this. And they make different decisions. So I think that one of the challenges we have in a complex society like ours is that we go down very focused sector-specific routes, which give us great expertise, but we do that at the cost of not learning about other things. And what we've seen, frankly, over the past 20, 30, 40 years is that healthcare as an industry has failed to keep pace in terms of efficiency and innovation with pretty much every other industry that's out there because of its complexity, because of clinical preference, because of so many different issues. So I think that the melding of business acumen with the health service is incredibly important. And with that, I'm going to have to leave you, Blessing, but I'm so excited to be here on The Dose, and I can't wait to see this and other episodes. Thanks so much.
Thank you so much for your time. Enjoy the rest of your day. Thank you for joining us. Thank you.
Bye-bye.
Bye.